Remember that resident doctors in Nigeria have gone on a strike because they complain of so many things that are not right in the medical firm, and this has actually cost them to go on strike. They said even their salaries and so many things are not in place. And even the most shocking part is that the president knows, because they gave a warning before the president left the country and he was not able to address that before he left. You can see how irresponsible he has acted in that area. And even those who are working with the president, I just wonder sometimes if they don't use their heads to think. Because if they're actually using it to think, they should have as well sit the president down, or even, those responsible, the ministers responsible for that, should as well speak to the resident doctors and agree, come to a compromise, agree that, okay, the president will be out of the country between this time and this time. Okay, this is what we're going to do. When he returns, let us attend to these issues. But of course, the government cannot even be trusted. So the resident doctors are likely not to even answer all of that. But of course, they should have agreed on something than the president just walking out of the country, leaving things, unattended to. And guess what now? The government is actually sending threat message to resident doctors to end the strike. Is it the threat that will stop the doctors from ending the strike? Remember who doctors are. If they don't work, a lot of people are going to die between the time they're on strike and until they will resume. A lot of people will go down. It is because the government does not care. That is why they will open their eyes and watch doctors go on strike. Doctors are like second God. Yes, they are like second God who save lives. That is what they are called to do. And if we're not taking such people seriously, that means the lives of these people are not even important to the government for you to allow doctors to get to that level where they will have to go on strike. You don't care about anybody, and you don't care about the people that you are supposed to protect as a government. Now you are sending threat messages to them, believing that your threat will make them resume. How can that happen? They are places for negotiations. Instead of them to negotiate with the right set of people, they negotiate with the wrong set of people. That is what Nigeria is experiencing today. And this has affected so many things, so many areas in Nigeria today. Anyway, guys, let's see the threat message that was actually sent to resident doctor and all of that. More details, guys. But please, if you have not subscribed, please ensure you do so right away. And also give this video a thumbs up. And don't forget to hit the notification bell so that you can get updated anytime we drop a new video. All right, guys, without further ado, right here it says the National Association of Resident Dr. Uyilawa Ikuhe Sui, and the Minister of Labor and Employment, Dr. Chris Ngige. The National Association of Resident Doctors has raised the alarm that it is being threatened by some government agencies to call off its ongoing strike. This comes 4 days into the nationwide strike, which, according to the association, is to protest against the failure of the federal government to honor the agreements, including the payment of salary arrears and indemnity for their colleagues who died in the line of COVID-19 duty. The national president, NARD, Dr. Uyilawa Okuihiesui, told us in an interview on Thursday that even though they had the duty to save lives, they are first human beings who had needs and should not be denied their entitlements. He said this was a fight for survival, noting that they were tired of signing a memorandum of understanding with the government as the previous ones has yielded no result. The leadership of the association had met with the federal government delegation on Wednesday night, during which the government appealed that the planned strike be shelved, but the association commenced the strike on Thursday, April 1st. The Minister of Labor and Employment, Dr. Chris Ngige, had said on Friday that government would not hesitate to invoke the no work, no pay provision in the labor laws if they fail to call off the strike. But in a telephone interview with one of our correspondents, Ikuhe Lucy said the government had not been fair, noting that since the association issued its ultimatum on January 25th and having written series of letters to the relevant ministries and agencies, nothing was done. The development has, however, paralyzed activities in many teaching hospitals across the country, inflicting serious hardship on Nigerians who need medical care in such institutions. Asked if Nigerians had helped in putting pressure on the government to do what was necessary to end the stalemate and address the inadequacies in the health sector, he said Nigerians are actually scared. Basically, people cannot talk because they are scared of the unknown and there's fear of being harassed. Since the strike started, I have received calls from many government agencies to shelve the strike. Some are in form of threats. It's that bad. They think it is politics, forgetting that we cannot play politics with human lives. We are professionals, and being a doctor means you have sworn to an oath to take care of lives, But when you are hungry or you become a patient, what is your fate? Efforts to get the NAD president to expatiate on the threat was not successful as his line could no longer be reached till press time on Saturday. Okohiyesui also said in the interview that government was unfair in the way it was treating them. He added resident doctors make up about 70% of all the doctors in the workforce in Nigeria. That is independent of the challenge many doctors have in securing placement for their residency program, and that is also a big challenge. That was why we mentioned doctors on Government Integrated Financial Management Information System platform in our communique. That is a platform used in paying doctors that are not fully employed in the hospitals. And so there was leakage and fraud in the platform and it was closed. That means the number of doctors on the GIFMIS platform, which was over 3,000, have stayed for 4 months without being paid. You can't place an embargo on the employment of doctors while the ones employed are not being paid. He also expressed dissatisfaction that health workers were still being paid 5,000 naira as hazard allowance. He said all health workers earn 5,000 naira as hazard allowance, while the hardship allowance of lawmakers is 1.2 million naira. Nigeria is a peculiar country and it is becoming frustrating. That is why you cannot blame the people that are leaving Nigeria. Doctors are first of all humans and they need to survive before they can treat people. So, when they have not been paid for 4 months, how do they treat others? Therefore, this is a fight for survival. You can see how serious this is. It is a very serious one, and doctors, they continue to complain. Imagine all that have been stated out and on how doctors have been faring in the country. A lot of terrible things are happening in the country. I feel bad for Nigerians and I feel bad for the country because it's heading to a serious coalition that would end up that would not even be able to be meshed together again, because where it is heading, if it hits the rock, it's going to break into pieces. So, my dear people, that is it. Thank you so much for listening. Whatever you have to say, please drop it in the comment section. And don't forget to give this video a thumbs up. Do have a pleasant time. Bye for now.